What systemic diseases are either caused by or influenced by poor oral health?
So with oral health, it's super complex in what is actually correlated, associated, directly causal, all that stuff. The consensus is that there is a very strong association between cardiovascular health, diabetes, stroke, Alzheimer's, obesity, metabolic disorders, even rheumatoid arthritis, some cancers, and then poor pregnancy outcomes, um, early birth, stuff like that. But there's no good data implying that any particular thing, if cured, actually affects these systemic disease states.
Hmm.
Very similar to inflammation. So anything you can think of with inflammation relation is oral health is probably pretty similar.
Yeah, that's what I was going to ask. Is all of the underlying mechanism via like a subacute or a chronic low grade inflammation?
100%. That was everything you kind of read through. It's just everything sounds exactly like you could describe. Put insert any inflammatory condition, and you're like, oh, this sounds like all of those, like and lightly correlated, plaques and all these things.
Yeah. So let me ask you this. You look at probably hundreds of miles a week. How
Yep.
many people do you ever feel like don't have any bit of oral inflammation? Do you ever find a mouth that you open up and you're like, these are just perfect gums? Or does there seem to be always some amount of low grade inflammation present?
There's there's definitely, I call them unicorns out there. They're these people who just have the perfect genetics. They have no inflammation. They have no, they're not getting cavities. They also take care of themselves. They kind of have everything going for them, but it's few and far between. The average person has some level of inflammation in the gums. And it's kind of a spectrum. There's gingivitis on one side, and then there's periodontitis on the other. And they're actually connected very well. Some people will never get to gingivitis or never get to periodontitis. Other people will just get to it the second they turn 25. And so there's some spectrum in between.
Before we move on, can you describe both of those, gingivitis and
Yeah.
periodontitis?
So gingivitis is what you go to the dentist and the dentist says you need to floss more. You have gingivitis, gum bleeding, right? And so it's
Mm.
inflammation, redness, swelling of the gums caused by plaques forming on those gums. So you're eating, little bits of food are staying in your mouth, bacteria is getting on those, colonizing. And actually, we think of plaque as a visible thing, but it starts invisible. It's super, super thin and small. It accumulates on there, and the gums slowly start to interact with that and get inflamed, especially once the plaque starts to harden into what we call tartar or calculus because it's mineralizing and then stuck there. And so periodontitis is the next level of gingivitis, is how I like to explain it. That kids usually have gingivitis, adults can have gingivitis and then turn into periodontitis. Periodontitis is when you have inflammation of the gums, but also the structure supporting the tooth. So the bone and the ligaments that are actually in there, literally holding the tooth in place. And we start to lose that. And that's when we call you periodontitis.
So is that virtually like an osteomyelitis, which for those listening is a bone infection, or is that more severe?
Actually, there's a very similar, I wouldn't say it's like quite there in terms of osteomyelitis, but we do have versions of that in
Right.
dentistry, where they're kind of obscure cases, we consider them, but for the most part, the bone is relatively protected. The gums are always in a sense, between the tooth and the bone, um, and they get super inflamed. The bone just recedes away in response to those inflammatory markers,
Interesting. So you
seemingly.
eat something, you leave behind fuel for these little bacteria, which are eating and accumulating and colonizing. They form like a biofilm, I'm guessing, and then that biofilm then builds up into plaque, which is calculus, and that structure then applies like a pressure essentially to the gum and pushes it back and causes inflammation. Is that right?
Exactly that. Exactly
Okay.
that. The only thing I would add is that the food left behind, it has to be fermentable carbohydrates. So, sucrose, table sugar is going to be fermented into lactic acid, and that's how that whole situation starts, really.
Interesting. I wonder if is there any data on like people who follow like a carnivore or a keto type diet and a reduction in oral issues?
That's a great question. I'm sure it is. I would bet anything that there's a strong correlation there. If not like something more, something with better data behind it, because it's so true. And even in my small patient population, anecdotally, the few patients I do see here who are on a carnivore or more common keto, they aren't getting cavities. It's just
Interesting.
they don't have the fuel for it.
Okay.
Yeah.
So it has to be a fermentable carbohydrate. Is there anything outside of brushing your teeth after eating carbohydrates that you can do? Like I've heard swish your mouth with water. Is there any validity to that?
100%. So in my paradigm of dentistry, I'm more of the touchy feely, nice dentist. I don't want anyone to feel like, oh, you're bad. Don't, you shouldn't do this. I'm not a parent at all. I am a parent, but I'm not a parent of my patients. And so I everything's good, better, best to me. And so, it would be awesome if we removed every speck of carbohydrates from our mouth after we ate every single time, with exceptions where you actually don't want to brush right after you eat because your teeth are slightly demineralized at that point, and you will
Mm,
scrape away some of that enamel, which is, actually very common. I see it all the time. And so, on the other side of that is simple: rinsing your mouth with some water. You're going to remove most of what's going on in there with just a little bit of swishing, which is what I kind of recommend to everyone. You can eat gummy bears and drink soda and do all these things, assuming you don't have the worst genetics in the world. If you swish with some water and don't extend how long you're having it for to hours at a time, we keep it to maybe 20-minute windows, really there's not going to be a lot of damage done in that short amount of time.
interesting. So there's two times that you've mentioned genetics, and I'm super interested to hear how that plays into it. Like how do genetic play into oral health? Is there something there where some people just don't colonize those bacteria, or what is it about genetics that influences oral hygiene?
So again, this is back to associations and whatnot. It's like nothing I'm saying here is rock solid golden, but anecdotally, and I'd say there's consensus throughout most practitioners that there's a very obvious genetic component that is kind of separating people into kind of two categories. There's the people, like I was talking about before, periodontitis. About half, actually 50% of the population in the US does have periodontitis to some level. There's a vast range of very mild, which in my practice, I probably see as gingivitis, to very severe, which is people who are going to be in a full denture very soon, or in the next years. Um, and then there's the people who will never get periodontitis despite awful habits, all that stuff. They just don't really get gum recession. They don't have those issues. But man, every time they come in, they are talking about decay. I'm looking, going, ooh, this one, Rick, it's not looking too good. It's right on the border. Yeah. So it's either, I like to say most people are either on the periodontal side or the cavity side. There's some people who are stuck right in the middle and it sucks. And there's also those unicorns, like I talked about in the beginning, that they're just blessed. They have no issues no matter what they do.
Interesting. So there's a difference between the bacteria that cause the gum disease and the bacteria that cause a cavity.
It's hard to say what exactly the origin of it is. This could be differences in inflammatory markers. This could be difference. It's certainly bacteria is different because we do know that bacteria in the mouth is most likely to be more similar to your mother than your father. And
Hmm.
so kids can come out of the womb basically, and you have great teeth, and then your sibling in terms of cavities, and then your sibling has awful teeth in terms of cavities. And then at some point in life, you're going to notice a reversal probably of, oh, one of us gets bone loss and the other doesn't. I don't know exactly why that would be. My guess, it would imply that bacteria has a lot more to do with it than anything else. They do think that bacteria is the key between mother and child. Um,
Interesting.
but I do think it's probably more systemic inflammation, all that stuff in is definitely playing a role there, along with diet. That it all has to do with it. All plays in.
And so we kind of described what periodontal disease is or gum disease. What is an
Hmm.
actual cavity? And it may sound simple,
Okay.
but what is a
No,
cavity?
yeah, yeah. So cavity's a little gray thing the dentist points at and says, "Oh yeah, you got this. See you next week."
Yeah.
So what an actual cavity is a tooth is the outer layer of a tooth is enamel, highly mineralized. It's very hard. It's the white part we smile with, all that stuff. A cavity is a demineralized site on the tooth that bacteria eventually, we have enough acid exposure from diet or the bacteria in the mouth, one of the two, it has to be one of the two, to penetrate into that enamel, make pores. And then once the pores are there, there's a site for those bacteria to sit indefinitely.
Hmm.
Once we're getting through the enamel, which is the first, you know, millimeter, 2 to 2.5 millimeters of tooth structure, there's the dentin layer. Now, dentin has pores built into it already. That's why when you have a deep cavity, we feel them, especially as kids. That's painful tooth. Um, and so the enamel basically demineralizes from the diet or the bacteria that are sitting there, never cleaned off, maybe in between the teeth where flossing comes in. Um, they get into the tubes, make the tubes bigger, get all the way through the enamel. And that's when we're at a true cavitation. And that's where the dentist is going to say, we need to get that out of there so you're not dealing with the dentin getting removed at this point.
Okay. So is there a difference between receiving like a filling and say a root canal?
Absolutely, yeah. So a filling is really going to be superficial. In a sense, we're replacing the outside of the tooth and somewhat of internal structure, but for the most part, it's just replacing some little chunk of the outside of the tooth. It depends where you are in the world and education and practitioner style and whatnot. But a big filling is going to be at most 2/3 of the tooth structure, the external, but really that's pretty huge in my practice. That's very large.
Mm.
Um, it's a regular filling is going to be probably 20% ish or even less, maybe 10% of the total external tooth structure there. And
Okay.
so they're small, basically, is what I'm saying there. A root canal is where you're actually going through the center of the tooth, going into the nerve cavity and removing all that nerve tissue, and which is, there's blood supply, there's nerve tissue, there's some lymphatic stuff going on in there. So you're removing all that and then filling it with a bioinert compound so that the body doesn't go back into that tooth, and hopefully bacteria also doesn't proliferate in there.
Interesting. Does the outside of a tooth that's received a root canal change in like color? Because if like our center tooth loses innervation or vascular supply, they usually kind of turn gray and die off, right? Does that occur with root
Absolutely.
canal tooth?
All the time. Yeah, absolutely. You
Oh,
nailed it. Front teeth, if you do see, we've all known someone who has that gray front tooth. It's probably that they have a root canal or they need one. If you banged your face as a kid really hard, you can actually, shove that tooth avulsate into the alveolar socket, basically, kill the nerve and the blood supply at that same time. But the body's so good at mitigating that when we're young, the tooth doesn't die in the same way it would if we were adults and did the same thing. The tooth kind of saves itself because it has somewhat of a blood supply still, seals itself off kind of. But what happens is the dentin actually grows inward into the nerve area, and where the nerve is it's a little pink string in there and with the vital tissue and whatnot, which gives the teeth a different hue. When that is removed completely and the dentin grows in, the tooth usually turns yellow. And if the tooth's gray, it's because there's an old root canal in there. Hopefully, it's because the materials they used to use were doing that, and hopefully the new ones aren't doing that. But
mm,
we won't know for another 20 years probably.
super interesting. I have something on my tooth. One of these teeth I'm super insecure about. One of them's like I've got a white spot on my tooth. What is that?
Yeah.
Can you see it?
So
One of
interest.
these teeth has a little bit of like hyper whiteness.
I cannot see that. And I
Okay,
don't
good.
remember it from with all the years of knowing you, but because you always had very white teeth. You should be the dentist. I should be, something else. So, um, the white spots like that are generally, we call them hypomineralization or hypocalcification, one of the two. And what happens is the tooth loses some of the minerals. We're getting toward that cavity side of things, but it remineralizes. And sometimes it turns a
Mm,
lot whiter from that. Now, that can have a ton of causes. It could be, and that was a front tooth, so you didn't get that until about 6 to 7 years old. So most likely it's not, from childhood lack of cleaning and whatnot. Otherwise, you'd have it more generally across, your molars in the back that came in at the same time. It's probably a little defect in the formation of that tooth, made it more porous, and then it comes out and gets remineralized, thankfully, and then stays like that.
interesting. Is there anything I can do for it? I think I looked up and they said your dentist can do fluoride treatments, which I'd love to talk to you about fluoride after you
Yes,
tell me what I
yeah,
can fix my bright tooth with.
yeah. So the easiest fix, and there's consensus on this, is that you just bleach your teeth. Because if you can
Mm,
change and lower the contrast between that very white spot and the rest of the tooth, it's less noticeable. Now, you notice it every time you look in the mirror. No one else has probably noticed it really because it's so minimal. It's one of those things that's my usual first recommendation. Another option is you can drill into the tooth, remove that extra white area, which is deeper than you'd think, and then put a filling over that or into that. I don't love that idea. I know tons of dentists who do. I've done it for sure. I just don't like the idea of putting a filling on the front tooth. My fillings, I'm not ignorant enough to think that they're going to last your entire life because we're going to all live a very long time. And unfortunately, the bond strength of fillings is what goes wrong, not the filling itself. There
interesting.
is a very cool 100-plus-year-old technique that I just learned about from a seemingly 100-year-old dentist, um, where you actually acid etch with, what was it? I'm actually going to do it soon. You need to buy the acid at like Orchard Supply Hardware. Um, you mix it with pumice, apply it to the outside of the tooth, and scrub it for about 10 seconds. You take it off, rinse with water. The tooth remineralizes with very good success, and the white spots are gone.
Interesting.
Mechanistically, I don't understand why, but that old dentist did send me a PDF of a book that was literally written in 1920
That's
of what
awesome.
it does and how it works. I just haven't read it yet, but he showed me many pictures and they were fantastic.
That's awesome. I'll have you do it for me when you master it,
Yeah,
when you get that
yeah,
down.
yeah.
So before I go to the controversial fluoride, you talked about the enamel has to be deteriorated in some way, and then you also mentioned like bleaching teeth. And I was just wondering, when you bleach your teeth, if you're using white strips or you're using anything else, with like a peroxide product, does that impact the enamel in any way negatively? Are you increasing your susceptibility to cavities?
You shouldn't be.
Okay.
I've never seen anything that says that it does actually increase your susceptibility to cavities. Now you're going to be more susceptible to ice cream being very cold. That's annoying, but it doesn't actually mess with those pores of the tooth and whatnot. It's changing the crystalline structure of the the things that make up the enamel. It's changing the crystalline structure within there
Hmm.
and breaking those little crystals down, which get stained over time. And that's basically the base of it. I never am concerned with someone bleaching, over bleaching, any of that stuff, as long as they're not burning their gums, um, and then getting so sensitive that they cry looking at water.
Right.
That does happen. I've seen it
Right.
several times. Um,
One other question on the whitening, because Victoria and I were just wondering this the other day. Both of us have had our teeth whitened, and there's like ones where you can go to just a shop that's
mhm.
not a dentist, and somebody just literally puts
Yeah.
basically what you could get over the counter on your teeth and puts a blue light in there. And
Yep.
then she got a very expensive treatment done by her dentist and came back and it was like blinding white. Like there was an
Oh
obvious
yeah.
difference. So what is the difference? Is it just the difference in strength? And is there a pharmaceutical prescription dentist grade strength only? Or is there a different difference between what you can get at a pop-up shop versus a dentist?
Yeah. No. Absolutely. So The pop-up shop thing is mysterious to me. I still don't understand how that all works. You can't even own a dental practice without being a dentist. So I don't know how these people practice dentistry and they're not dentists and
Right.
they're in like a mall. There's probably like a hygienist overseeing them. It makes no sense. But what they are using a non-clinical strength, basically bleach on those teeth, or peroxide mix, basically, to getting those to lighten up. They can probably do a little bit better than you can at home, and it's cheap because of that. They're making, I don't know, I've never been to one myself. I've just heard things about them. And my assumption based on the results I see, basically they're going to make you some sort of tray that fits to your teeth pretty well. That's one of the expensive parts of having it done at the dentist, because that's a retainer, basically. Those
Mhm.
are in the hundreds of dollar range. So they're going to make you that retainer and then put some bleach on there, which you could just have yourself and do it yourself.
Hmm.
Also, they might put a little fancy light in your mouth too. It doesn't do anything,
I didn't think so.
probably. Um, Now you go to the dentist, you basically get the exact same thing, except they're going to use significantly stronger solutions in there. And so that's why it's called Zoom, is the popularized version of it. It uses a blue light. The idea is that UV charges up the particles and blah, blah, blah. It probably does nothing, honestly. It's a marketing gimmick. Unfortunately, everyone asks for it at this point, and I don't know that all dentists know that it probably doesn't do anything. But at this point, the demand is so high, and people just want that. And if you don't give it to them, they're just like, "Oh, it didn't work that good," and it's complete
Right.
placebo. They
Yeah.
assume because it wasn't this bright blue light in their mouth that it wasn't going to work. But I would say if it does anything, it's a 5 to 10% difference, and it's very minimal.
Gotcha. Okay. So fluoride. What's up with fluoride? Is it good? Does it belong in the water like some dentists have historically said? Or is it killing us and calcifying our pineal gland and a form of
Yeah,
governmental control?
exactly. It's a form of sedation and to take God from us. Um, so as far as systemic health is concerned, I am not a physician. So I can tell you what I know from teeth, what I see, and kind of some relations there. I did pull some kind of cool numbers just to check, just to look at this. So fluoride is fantastic for the teeth. It's so well established. There's no question. When we have fluoride in water, in toothpaste, in all of these things, we see remineralization of the teeth. Um, that's those cavities we were talking about. It's getting into those exposed pores and potentially sealing them off sometimes. With good habits, after I diagnose a very small cavity, I do have people go. They start using a stronger fluoride, have less acid exposure, less sugars, and all that stuff, and they come back and it seems like they're smaller and they're less in need of having those cavities taken out at that point. We're talking very small, so don't go out. Don't stop getting your fillings done because of that. The dentist would tell you if it was possible. But we do see that happen, and it's super consistent. We also know that populations that do have fluoride in the water, the children have significantly less decay. And when children have less decay, adults have less decay, because a lot of decay that we're experiencing as adults started when we were children. Honestly, it's when our habits were very poor. Mom and dad thought we were good enough to brush our own teeth when we were years away from it. Most little kids only brush their front teeth. And children's diets are, typically very full of fermentable carbohydrates. So they're getting full exposure all the time. Um, and thankfully it's mostly on baby teeth, but you get your first adult teeth at 5 or 6 years old, and a lot of time it's those back molars, your first molars. Parents don't even know they're there because you didn't lose a tooth to get them. They come in behind your baby teeth. So we get those coming in. Parents don't know yet. Baby kids still eating popsicles in bed and not brushing. And then that's where those teeth start to decay and get those. The seeds are planted, is kind of how I like to say it. And then as an adult is when we end up getting the fifth filling, the crown, the root canal, then the extraction, and then an implant at some point. And that's why the first molar is the most likely and most missing tooth in globally, actually.
Interesting. So the
So
oh, go ahead.
I was going to wrap it back to fluoride there.
Yeah.
So with fluoride, I was looking at some stuff recently, and we do know that population with fluoridated water have about a 26% decrease in decayed and missing teeth. That's pretty significant because I don't actually know the global numbers, but I'm very confident saying there's billions of people globally who are missing teeth. In the
Right.
US alone, we have 100 million people who are missing at least one tooth, and most of them are averaging much more than that. I think there might be even, the last time I looked at this, I think there was 160 million Americans they speculated had at least one missing tooth. So 26% decrease is pretty significant. I actually live in an area where there is not fluoride in the water. A lot of California doesn't. And between me practicing here and me practicing when I was in school in Utah, I do see a change in how many kids come in with cavities, basically. And even more significant and kind of interesting is here, there's obviously a movement for anti-fluoride, getting it out of the diet, not using it in toothpaste and all that stuff. There are children I see, the worst cavities that I've seen so far are always in children who have a complete absence of fluoride in the diet. Most do not, obviously. Most toothpaste has a little bit and stuff like that. So you get some topical application. But as a child, those teeth are also developing in that time, and some systemic fluoride does help to harden those teeth as they're they're developing still. When I do see that absence of fluoride completely, I'm always kind of puzzled looking at their teeth. And then I'll end up asking the parent and say, are we having juice in bottles, or, sleeping with milk, or something's going on here? Because it's just the whole mouth is demineralized. And it's always almost comes back to they avoid fluoride. They use natural toothpaste. It's really bad because those kids will be very likely missing several teeth, I would say, before they're 50 years old.
So what's the argument against fluoride? Because you just made a pretty good one for fluoride. So I know you're pretty open-minded and evidence-based, so you've probably looked into it. What are the claims against fluoride, and is there any validity?
So yeah, the claims against it there are vast. In Germany in World War II, they were using it in the water, I believe, at the concentration camps to sedate the population there and whatnot. Now, I don't know what dosage they were using that at. I was trying to find it, actually. I couldn't. I'm sure it's out there. Interestingly, we talked about the pineal gland and all that stuff. I do not think that's the case. It would be pretty cool to see some calcified pineal glands when we were in cadaver lab, though, if that was possible. But it does have effect on the thyroid. We know that for sure. It likely does have some effects on the brain and high concentration. And interestingly, too, we know that it has effects on the teeth poorly at very high doses. We call it fluorosis. And you may have known someone growing up too who had nearly black front teeth, or black lines or something like that. And actually, the white can be from that too. But it's basically their mother or them as a child had extremely high fluoride for long periods of time, and then they get this odd, unesthetic look to those teeth. So, at high doses, we know that that's an issue. Now, I did look up the LD50 of fluoride is 7 to 10 grams in one serving. That's a lot. The U.S. water, where it is fluoridated, is regulated to be between 0.7 and 1.2 milligrams per liter of water. So if you're in a fluoridated area, say at most, and where it's done well, you're probably going to maybe get to 3 milligrams a day of fluoride if you're drinking only tap water.
So you said that the LD50, and then for those listening, LD50 is the lethal dose it takes to kill 50% of the population that's exposed to that drug. So the LD50 was 7 to 10 grams. Is that correct?
Correct.
And what we're getting in water on the high end would be around 3 milligrams.
3 milligrams. So we're,
3 milligrams.
2,000 times away from getting to a lethal dose.
So around 2,000 plus gallons of water consumed to hit that dose where it would cause lethality, I guess. But that doesn't necessarily mean that it doesn't cause some other issues, right?
Absolutely, yeah. So dentistry, I'm not trained on this side of the field for sure, but we do know that thyroid is affected by fluoride, high fluoride particularly. And interestingly, I did check the dosage of fluoride used to treat hyperthyroidism is 2 to 5 milligrams a day, and so that is definitely within reach for a lot of people. And once I read that, I then kind of looked a little deeper into it. And there's a decent amount of studies showing that the fluoride in just tap water for those populations does seem to have an effect on TSH levels, T3 and T4. Meaningful or
Interesting.
not, it's on the lower end, but it does more likely lead to, it could potentially lead to some hypothyroidism in some populations.
Yeah, so to treat hyperthyroid, to suppress an overactive thyroid, the doses given are somewhere between 2 and 5 grams, which the daily water, or 2 and 5 milligrams, correction, is given, and then the daily water amount that you would take would be around 3 milligrams. So it falls within that efficacious dose to suppress thyroid function.
It seems to, absolutely. Now, I don't know if fluoride is a commonly used treatment for hyperthyroid. I don't know anything about that really, but that was or is a treatment level is 2 to 5 milligrams a day. So
Super
there are
interesting.
people who could definitely find that in their water.
So do you actually need to consume fluoride, or can you just get away with applying it to the teeth and then maybe getting a small amount into systemic circulation? And would you be fine with that if you only use fluoride toothpaste but didn't drink fluorinated water?
So we know during development, child development, and during pregnancy, even some fluoride is very beneficial for the formation of those teeth. Likely, there's benefits in formation of the bone too, but it's so extreme we don't see those issues. So we do know that it's an aid in that way, and I would say those studies showing that we have a decrease in decayed and missing teeth with populations with fluoride in the water, more likely it's just that as children they had it in the water, and during development of those teeth and topically all the time, they were less likely to have decay get all the way through, more likely to have remineralization, etc. Now, for adults, there is no need and no use for systemic ingestion. That doesn't make sense. There's no need for constant intake of fluoride
Sure.
in consumption, basically. But
Uh,
topically, it's still very useful. We
okay.
absolutely know that on those patients who are cavity prone, and even the ones who aren't, the ones who are using fluoride on a daily basis via their toothpaste are getting less cavities than the rest.
Interesting. Is fluoride found naturally occurring in any way, or is it completely synthetic?
That's a great question. Fluoride let's see, elemental fluoride is never found naturally occurring because it's so reactive. It binds to
Right.
everything, hydrofluoric acid and things like that. There are populations who do have naturally occurring fluoride in their water supply in mountainous
Interesting.
areas and stuff like that. And you do see issues in places like that where they'll have fluorosis, hydrofluorosis, um, and have like we were talking about the white spots, the dark spots, stuff like that. Basically, malformation of some of their teeth because it's so high.
I was trying to get ahead of the appeal to nature group that is going to say that it's never occurring naturally, and our ancestors would have never been exposed to this, so we shouldn't be either. But sounds like potentially, based on where they lived, they may have been exposed and actually had negative effects. And And yeah, that's one thing too. Like our ancestors probably died a lot of times just from simply drinking water and getting parasites and whatever, like living like our ancestors
Absolutely.
in isn't always ideal.
Absolutely. That's a great little side note there, is that, you know, our ancestors were hunters and gatherers, and the lifespan was significantly shorter, for a lot of them at the very least. Maybe they could live as long, but it was, the likeliness was low, right? They also had low fermentable food diets, so they weren't getting all these carbohydrates refined and whatnot. And so I always tell this to patients, who have crowding. We talk about, orthodontics and braces every day. 100,000 years ago, you were running on the prairie and a saber-toothed tiger got you, and you died at 26 with your perfect teeth.
Right.
And you already had grandchildren, so you were fine. You'd already helped the species. But on the other side, you were running and you got away, but you tripped and knocked your front tooth out. You were really hoping those neighboring teeth kind of shimmied on over and got in the space there. Not all the way, but enough that you could still chew really well. And so that's just some of our caveman genetics hanging in there and causing the crowding, basically, that we see with everybody. If you're not wearing your
Interesting.
retainers, you're gonna probably get some crowding.
So yeah, so you're saying that essentially our teeth are genetically kind of wired to come in case we were to lose one via trauma?
Very likely to be true. It's
Huh.
it's
That
very
makes sense.
consistent to see across the board, that as we age, if you aren't there's I've seen, I can think of two people who in my practice I've seen, and I asked, "Oh, are you still wearing your retainers?" And they're like, "No, haven't in 40 years." So they're just very lucky. But yeah,
Interesting.
interesting.
Yeah, I'm one of those who I would have been genetically screwed because I never had braces and my teeth came in pretty straight. Though I did
Uh-huh.
get crowding and it helps my defect because I used to have a gap in my teeth. And then my wisdom teeth came in, and the dentist at the time said I didn't need to have them removed because I had space. And then they fixed my teeth essentially, like my top teeth. I do have slight crowding on the bottom, like one of my teeth is slightly elevated over the other. But that's super interesting. I've never heard that. That's really cool.
Yeah, it's super interesting. And that brings up another topic. Is it in dentistry? We did used to think wisdom teeth came in and pushed everything forward. Turns out not at all. They don't apply any force
Oh,
forward. All teeth want to move forward. So if you just
okay.
took out your lower front tooth, one side or the other, something's gonna eventually find its way in there, unless there's enough pressure from your lip to hold the teeth back. Which somewhat
Interesting.
there definitely is. Your front teeth would continue to move forward had this upper lip not be giving them support.
Yeah, I actually had I don't know what you call it, frenulectomy, or I had my
Frenectomy. Yeah.
frenulum. Yeah, frenectomy. Yeah, I
Yeah.
had my frenulum cut when I was a child because of the gap. So maybe
Hmm.
that was actually what happened, and my wisdom teeth had nothing to do with it.
Yeah. And it's probably both. That's the reality. It's probably a little bit of both. And they were just, and you did luckily have enough room for the wisdoms to come all the way through, which is also rare. There's a
Interesting.
whole nother topic of, you know, anthropologic effects of food and whatnot, and if we're getting our airways open enough, and and that likely does have some effect there too, but there's just the data is not there to support that
Yeah,
crowding
the
is
the next
related to
thing
that, but it's
next I was going to ask
probably
on
is.
was on the genetic standpoint of can we determine anything about how our ancestors' diets were, or how ours maybe should be based on the style of our teeth? Like, do we have our omnivorous teeth or carnivorous teeth? I'm definitely asking a leading question there, but I'm interested in your response.
So unfortunately, as a dentist in the US, we're not trained in anything anthropologically. So that's a great question for a biologist. But dental wise, I my education, it was none in that. My biology undergrad degree had maybe a little bit more, but even there it was very slim. We do very much have teeth that are made for cutting, and likely
Mhm.
meats and whatnot. So, and then also ones made for grinding in the back. That's kind of all the
Meaning
dentist
a mixed diet, though, that would basically
mixed
imply,
diet.
right?
Yeah,
Like grains,
definitely
fruits,
seems
because we
like a
have
mixed diet.
And from the little research I've done, like the Iceman, that's like one of our only cavemen that we've kind of found frozen. We found grains within his teeth and the back teeth because it seems like those are meant to basically mash up grains. Then we have our canines. What are those, incisors, or what are these called again? The canine
Canines,
ones.
cuspids.
Yeah, cuspids. Yeah, those are more meant for cutting into meat. It would seem, right?
Yeah, tearing, cutting, um, yeah, anything that's pretty fibrous and hard. It could be meats, could be scraping bone. Our incisors are very good at that, scraping bone, and things like
Hmm.
that. Yeah.
Interesting. So
Interestingly,
yeah.
along with the developmental side of the mouth, like I was just talking about, there is some thought that potentially some of the crowding we do experience is due to lack of growth of the maxilla and mandible, which is the upper and lower jaw. There's some thought that we aren't getting enough tough foods in our diet from a young age, which leads
Hmm.
to a deficiency there. And in modern times, we get braces and fix all that stuff, hopefully. But chewing on bone potentially, and we know our incisors are perfect at scraping bone. That is potentially a way that maybe our ancestors weren't ending up with as much crowding, is that their jaws actually had more space.
Interesting. That's super. So make your kids chew bones and tough food.
Yeah, exactly. Yep. Oh, yeah. And we do, when you do have a toddler, you have them gnaw on stuff because it does start to teach them how to use their, the muscles of mastication, we call it, use their tongue, manipulate and everything. I know my little daughter at, I don't know, she was about 9 months, and we had ribs one day, and she loved it. She was going ham on just the leftover bones and just kind of gnawing on the whole thing and
Huh.
drooling all over the place.
That's cool.
Again, that is
So
not dentistry and that is not dental school. That is a lot of speculation.
yeah, but you're also well versed and well read on your own accord. So I wanted to pick your brain on that stuff too. And again, this I'm going to pivot to something that I'm sure you would never learned of in dental school, but you and I have talked about off air, which is the effect of mouthwash on our oral microbiome, and then potentially leading to issues with cardiovascular disease. Somebody who talks about this a lot is Dr. Twyman, who I've had on the podcast. He's big on nitric oxide, and he thinks that cardiovascular disease basically stems from the dysregulation of the arterial lining or the endothelium and the glycocalyx. And so his opinion is always that if we can preserve the glycocalyx and preserve the endothelium, that we can avoid heart disease and not need any of the issues. And one of the culprits that he sees, or that he feels, I guess, is mouthwash that's destroying the microbiome and then inhibiting nitric oxide production systemically, and then leading to issues in that arena. I know you never learned this in dental school, and I'm sure they would never bring it up. But with your own bit of like research, what have you found on that? And maybe you can talk to us mechanistically, and if it actually seems to be meaningful in any way.
Yeah, so we have talked about that before, and I've looked lightly into it, and so I kind of refreshed a little bit on. I found a newer study that kind of was talking about chlorhexidine. It's
Hmm.
probably our most commonly used prescription strength mouthwash for mostly for the periodontal issue side of things, sometimes for the decay side. Not in my practice. I'm not giving people prescription strength mouthwash for decay issues,
Yeah.
to be honest. But in the hygiene side of it, where we're talking about people who have periodontitis, they're losing bone. When you have that recession of bone, you're gonna have a lot more gum tissue. When you have more gum tissue underneath the tooth that isn't cleansable, we're gonna have a lot more bacteria, anaerobic, all these, the ones we don't want basically are gonna proliferate more down there. And so that's where chlorhexidine does have some efficacy, we know, in helping to treat these people who have basically way too much bacteria in their mouth, and we can acutely lower that over and over and over using something really strong like chlorhexidine. I'm sure in surgery you've used some sort of similar chlorhexidine style, rubs and whatnot
Every
to
single time.
sterilize. Yeah,
Yeah.
exactly. So I wasn't sure if they still use the same stuff. Like in dentistry is chlorhexidine gluconate. I know there's a bunch of other various forms of it.
Either that or
But
betadine.
interesting. There you go. Yeah, exactly. I always wonder. Yeah, never mind. Chlorhexidine. We do know from studies it does. Interestingly, it lowers the pH of the saliva, which is kind of backwards. We usually think of it as a good thing for the teeth, but lowering saliva pH to a more acidic zone is not good for sure. Um, it also lowers the diversity of the bacteria in the mouth. Another thing that's probably not great, and acutely reduces nitrate reduction bacteria in the mouth. So we're getting less nitric oxide because it's staying as nitrate in the mouth and then going into the gut, where I don't know if we probably do have nitrate reducing bacteria in there. I don't know, but I do know there are in the mouth and the back of the tongue. And we do see an increase, or the studies do see, I don't see, the studies do show an increase in acute systolic blood pressure from that. But it's not statistically significant in the studies that I saw. But it was there. You could see it. It was like 2 or 3. It was just a small bit. But interestingly, I thought it was going to be only post use of the mouthwash, but it seemed to be a person using it once a day for a week had consistent slight elevation of their blood pressure. So I do think that all points to exactly what we were talking about, where we are getting somewhat of a systemic effect on decreased nitrate reduction, which is less nitric oxide in the system systemically, and probably contributing to hypertensive populations more increase in hypertension. And then even in the groups that were normotensive, they did see increases in blood pressure.
Interesting. Super interesting. So that's mainly talking about chlorhexidine. And like Austin said, that's basically like an antiseptic that you would use pre-op, or we do use it orally occasionally. Like, you said you never really would prescribe that. But when I've seen it used is like in residency in the ICU, if somebody is like intubated or something and we can't take care of their hygiene, we'll do like a chlorhexidine swab in the mouth. And that's interestingly where I've seen the paper done was on the outcomes of ICU patients who received chlorhexidine mouth swabs. They had I can't remember the exact study, but basically their outcome was poorer than those who didn't, which led people to start speculating and going down that rabbit hole, which is just super interesting. But I wonder if over the counter mouthwashes have the same impact. I think you can assume that if they're doing the same thing, which is killing off those bacteria, like you discussed, then potentially it does. Is there something different with the over-the-counter ones? What's the ingredient that is like ethanol based?
A lot of them are ethanol based and not good. Honestly, they dry the mouth
Not good.
out and make your breath worse. So
Mm.
I'm not a huge mouthwash advocate either way. I just don't think they're that useful. I think they're kind of a topical band-aid. And for most people, like you use the mouthwash to clean the breath, and then it's worse after an hour. So I think you're better off if you want something like that, just chew a piece of gum that doesn't have sugar in it, or a mint or something like that. I do recommend it fluoridated mouthwash for my patients who are severely cavity prone and or have xerostomia, which is no saliva production, very common in
Hmm.
cancer patients and whatnot. And so there's definitely some uses for it, and I would say it's not controversial to just say if you use mouthwash, your teeth are more likely to be better. Very
Hmm.
simple. They're not the alcohol. If they're alcohol free, your mouth is going to be better for sure. But if there's fluoride in it, they're usually alkaline. You're balancing some pH in your mouth, reducing some bacteria, or probably a lot of it, which should be helping the teeth get less cavities. The question is, are you reducing all of the bacteria? It's probably yes. You're probably reducing good and bad bacteria, which then just recolonizes anyway. So it's a question of efficacy and how useful is it, and it's very just person dependent.
Interesting. Is there any validity to mouth taping?
Mouth taping, in terms of
Like at night?
bacteria, yeah, no, yeah.
Yeah, I just thought,
Yeah.
one thought that I had is you mentioned the reduction in saliva, and correct me if I'm wrong, but the drier the mouth is, the better environment bacteria have. Is that
Yeah,
correct?
it is.
So
It's
I'm
interesting.
wondering that if we close our mouth while we're sleeping, do these patients have better outcomes if they were to tape their mouth and have a closed mouth while sleeping instead of open and dry?
I would speculate yes. If we could get people, there is direct. There are some people who get gingivitis simply from mouth breathing consistently. They're getting inflammation of the gums from mouth breathing. Now, I do not know exactly why that is, but it's bacteria. It's just going to end up being that way, that they are consistently having a dry mouth, which is going to have lead to worse populations of bacteria and microbiota in their mouth, which is leading to that inflammation, et cetera, et cetera. And the decay is rampant in cases like that. And, we could, if mouth taping would be a good solution for some of those people, but unfortunately, there's probably so much else going on that it's not
Yeah.
enough, but
Have
probably
you ever
good
tried
for them.
that? And
I
by the way,
have.
listeners, Austin is quite a bit of a biohacker as well and very into this stuff. So yeah, I want to know your experience with mouth taping.
My problem with mouth taping is my mustache, but also I tend to wake up and pull it off at some point. I can't
Same.
keep it on. I haven't bought any really high quality ones though. I'm just using medical tape and
Mm.
it's not strong enough for me. In my sleep, I seem to have no control of my my willpower. It's gone because I can't keep an eye mask on even though I need it for the light. I can't keep my mouth taped shut. I end up pulling it off. I wake up feeling like I'm super hot from either of those two things, and I don't think that's the case. It's just distraction. Interesting, I can keep a mouth guard in. That doesn't bother me. I trained myself into that one. So maybe I just need to do it every single day for the rest of my life, and it'll eventually be okay.
Yeah, I tried it. I got some of that. I forget the name, the one that Mark Bell's behind, but they sent us some, and I
Uh,
tried it, and
yeah.
it's good shit. But it was hard for me. I just couldn't. I didn't feel. It kind of made me anxious at first. So it was like making me so I couldn't go to sleep because I was thinking about like I'm having to actually breathe through my nose and I can't open my mouth every time I try to. It's like pulling on my face, and
Hmm.
so it was kind of disrupting sleep. And when I did finally fall asleep, I also woke up in the middle of the night feeling like I was very dry and I needed a sip of water, and so it just came off.
Yeah,
Um,
exactly.
uh,
I have the
so
same
it's
problem
tough.
because I wake up and and if you have a spouse, you're probably going to mention a few words every once in a while in bed,
Yeah.
and so you're finally like you're about to fall asleep, and then it's like blah blah blah, and you're like,
Mm.
and oh
Yeah.
yeah, exactly, and it's dark, they can't see that your mouth's taped shut, and so they're just
Right.
confused. Yeah, I do think it's an interesting dentistry does have a little bit of sleep apnea side to it because although we aren't treating physicians for the apnea, we're not able to diagnose it. We can definitely see signs of it, especially looking at the tonsils, looking at the tongue size, looking at people with collapsed arches in the mouth, not the foot. Um, they are going to have less room for their tongue. We do recommend people get sleep studies done or ask their physician about getting a sleep study done because again, I can't prescribe that, but we do see that. And then often, I don't know what the studies say anymore, but huge prevalence of people with sleep apnea not using their CPAP machine. The next step is generally some sort of oral appliance to kind of pull their jaw forward and get their tongue out of the way of their throat. And so we
Interesting.
do make those appliances for when asked.
We have a lot of bodybuilders listening, so sleep apnea is a good topic to touch on. And CPAPs are interesting because is there any risk of CPAP being a vessel for bacteria?
It's a great question. People who do use CPAPs, and again, this is anecdotal. We do see some strange things in the mouth, and it's usually kind of dry. Again, they put humidifying solutions in there and whatnot to help with that specifically, but you're getting air blown directly into your mouth, which in a sense makes you a mouth breather again. For
Yeah.
some, I know there's some that go over the nose, but we do see some negative effects in the mouth for that, but they're so minimal compared to the need of breathing properly and sleep. It's never something we're considering like, oh, you shouldn't use this for that reason. But yeah, there is some kind of interesting bacterial stuff that can go on, and that's when generally my hygienists are the ones dealing with that type of thing and noticing it more and mentioning it to me, and we can talk about some options. Some people are more seemingly getting more decay because they're getting that dryness again.
And do you ever make oral prostheses for these people that aren't going to go through like a CPAP?
Yeah, exactly. I have a few options. I have some FDA approved appliances for treating apnea. And then I also have some that are not FDA approved and are more on they're called silent nights. And they're a snore, they're for snoring, which really is a spectrum of, is snoring actually light apnea or not? It doesn't seem to be for everyone. But they do work probably with those populations who are on the light end of apnea. And it's basically two retainers that are really thick acrylic material, go on the top, go on the bottom, and they're connected by a band, and it just pulls you just ever so slightly forward, which then, for most of those people, lets them breathe a little bit better.
Interesting. So it's just opening up the airways.
Opens up the airway. I do think it makes some people mouth breathe, but they were mouth breathing. They were mouth breathing before anyway,
Yeah.
and so you can't kind of win it all. But I do
Right.
know of many people who just having their jaw pulled slightly forward allows them to nasal breathe. And I even know for myself, I wear a regular night guard for grinding, and when I wake up in the morning, my jaw is postured forward, and it's just because anatomically my TMJ joint would rather be seated a little bit farther forward. It does let my jaw come forward, my tongue then comes forward, and I do have more space to breathe.
Interesting. And a good point I think you pointed out there is that sleep apnea and snoring they don't always go hand in hand. So, some people I will also suggest that they get a sleep study because I'm seeing things in their labs like elevated hematocrit hemoglobin,
Mm-hmm.
decreased IGF-1 testosterone, things that could potentially be linked to that. And they have a large neck, et cetera. And they're like, well, I don't snore. Well, sleep apnea isn't always associated with snoring. And there's various types of sleep apnea, right? Like there's structural and then there's also central. I don't know if
Right.
you dive in a lot to that, but if you do know a bit, because I'm not a super big expert on it, but maybe you could differentiate those two if you know a bit.
I couldn't give you the differential. I do know that I'm on the structural side.
Gotcha. Yeah. So
Yeah.
it's either like there's a structural deformity, like something is like closing your airway, and sometimes it's mass, like you're just a big
Mm-hmm.
person with a
Yeah.
lot of neck
Your
that's
neck's
closing the
heavy.
airway. Yeah, or there's something in the central nervous system where the brain actually isn't sending the signal. And I don't know the treatment for that actually. I'm not a ENT guy and haven't really delved into it all, but I need to look into that.
Yeah, nor am I. And actually, that is interesting because I haven't really heard that. That's another thing we're not really trained on in school, but then kind of are forced to pick up. Um,
Yeah.
there is, the brain part of it is interesting because our populations of people who do have apnea are generally also bruxers, which just means grinding. They're grinding in their
Mm,
sleep. There's data with children that shows that the kids who snore very likely grind. Um, and a lot of kids who grind sometimes also snore, which is usually an airway issue in them. And so that's one of the main things we're doing with children and evaluating is looking at their teeth, seeing if they're grinding and deciding if it's, you know, habitual, if it's during their sleep, um, and, kind of evaluating there and trying to give the proper referral if needed. For me personally, if I see someone under the age of 6, where that's where we're getting some of those adult teeth in, which often stops the grinding in habitual cases. If I'm seeing that, and I always ask the parent, do they seem to snore? And sometimes they say yes. That's usually a referral out to a physician or a pediatric dentist or even an orthodontist, just to have their jaw evaluated for being big enough. Because I don't know what the effects of basically being an apneic at 5 years old would be, but they definitely can't be good. They're not going to be
right.
good.
Yeah. Yeah. Not
Yeah,
getting
so
oxygen to
we're
their
going for
brain is
early
not a good thing.
intervention.
Right.
Exactly.
And what's the cause of the grinding? Is that more central? Like, is that I guess it's not
Yeah,
psychological if they're outside of consciousness, but maybe some would say that it's like this built-in trauma or something. But what from a scientific standpoint is causing that while somebody's sleeping?
that's another interesting thing. I don't know the actual cause of why people are doing it, but it is so widespread in the apneic populations and not. The idea for some of the thought process, some of the current thought on the apneics is that it's a stress response, and possibly when you are having trouble breathing, you're laying back, your tongue may be getting in the way, your tonsils are swollen, some effect there, that structural side of things. It seems to be probably helpful to clamp your teeth down, and that might get some of, I don't know if it gets your tongue out of the way, or there seems to be something there of why people are doing it, but I really don't know what it is, but it's so universal.
Yeah, that would make
The hard
sense,
part of
because
that,
if they're crunching down and they're changing something structurally and allowing more air in via nasal passages or something, that's super interesting. Because yeah, are you familiar with like breath work practices where they essentially cause you to hyperventilate?
yeah.
Yeah. So like Victoria and I in Mexico did a hyperventilation session, or breath work as they call it. And
hmm
it's pretty soon on, I was like, what's going on? Did they put something on my face? Because my face started going super numb and then trying to close. It felt like my mouth was clenching down. And then, of
Uh-huh.
course, instead of going through the like spiritual awakening that I should have been, I was in there thinking of the physiology of it. And I'm like, right now I'm breathing so much that my body is trying to mount a response to shut my mouth and to force it
Yeah.
closed, because I'm breathing too much and we're getting oxygen toxicity, which is super interesting. So it makes sense that if the reverse is happening, that maybe it's doing something so that we can open up the nasal passage or something.
Yeah, exactly. That's actually really interesting. I've never heard of that. But yeah, and another thing that's hard, just like the rest of this conversation with the mouth, is that the population as a whole is so many people are grinding at this point that it could just be correlation. I mean, it just could just be it could just be random. I'd say 60% of my patients seem to be in the grinding population or have been grinding at some point, and it's pretty obvious on their teeth. I don't know what percent of the population is apneic, but if 60% of regular people are grinding, it's not surprising that the apneics are also grinding. So there's a chance that there is no real relation there, but I doubt it. I do think there's
Yeah,
probably
right.
a strong association.
Well, super fascinating conversation, man. I love this stuff because I don't think we ever talk about oral health enough. As far as I know, I certainly don't follow any like influencers in the space who are just crushing the oral stuff every day, which I think they should be. And we learn a lot about cardiovascular health and inflammatory issues and everything, but we have this our vessel into the body is on our face. It's like so big. If something is
Yeah.
happening, it probably is starting here, and we rarely talk about it. So it's super exciting and fun to talk to you about. I want to close with you telling your max lift, so the listeners know that they weren't listening to just some academic, and they know they're listening to another fellow bro. So what's your max deadlift?
So my max deadlift is 727 in competition.
God damn.
My gym lift is 760, which was also in competition, but I got a technicality. My head moved forward, so I didn't
Okay.
get that one. And then my best squat was in that same competition, was 550, and I am a perpetual pec terror, so I no longer bench anymore. But I think my best was actually my first competition before dental school. I think I did 325. I've done more than that in later periods. I've gone up to 345, but I've torn my pec, I think, 10 times. So it's
So
a lost cause.
the insanely strong dentist. So yeah. So for those of you who made it this far, you weren't just listening to some nerd. He's jacked and tan and super effing strong. But thanks a lot, man. Where can people find you if they want to learn more? I mean, I guess you're not really posting about this stuff, but maybe they can come to Petaluma, California, and get their teeth fixed.
Yeah, I do practice in Petaluma, California. I practice with my dad, stepdad. We have a little family practice. We're very much just, I'm my neighbor's dentist, is what I like to say. I'm not on the spectrum of saying you need to do this, you need to do that. I'm just kind of this is what's there. Do what you want. I'll be here on Tuesday. So yeah, if you want to look, my Instagram is power.dentist.